first question is, do you have placebo effects in animals? Yes, you do, but is it because of the animal or because of the caregiver? This is the caregiver effect. What you see here is, that's in dogs, cats and in dogs, the effects of placebos, and it's largely driven by the caregiver, the person owning the cat or dog. They think, oh, this works fine. The cat just still limps on and has disability, but the caregiver thinks. And interestingly, the same happens if you look at humans. We have the caregiver effect too. This is in patients here with IBS, and this is in patients with depression. And people treating those, being responsible for or caring for the people, they think, oh, this works fine. This is placebo effect. So giving a patient a placebo, the one caring for this patient, they see, oh, it's a large effect, but the patients themselves have a rather smaller effect. So we have the caregiver effect in animals, and we have it, of course, in humans. That's a wonderful study here by a group from Plymouth in the UK. They gave placebos to children in the age of 5 having tantrums. So they would freak out several times a day. They gave it to the parents, and the parents gave the placebo to the children. What happened is, after you gave the placebo to the children, the tantrums went down, the frequency and the intensity. But this was driven not by the children, but by the parents being less stressed because they gave something to the child. This is called the placebo by proxy effect, which is quite powerful. So you give a placebo into a system, and the whole system reacts to that, and in the end you have a decrease in symptoms in the patient. Another explanation would be that you have placebo effects in animals is the human contact effect. And I was, that's not my field, but I was intrigued by these findings that if you are standing amongst some chicken, after some time, of course, they have a reduced stress response to you standing there. And that kind of, well, this is my first study ever published, 1995. That was when I was a student. We were stressing humans for 5 days in a row. And of course, the stress response went down. So the same effect we have in animals, we have in humans. Another study by this group showed that if we got physical contact to an animal, if a human touches an animal, the stress responses will decrease. Same happens in humans. This is a study by couples, and the female part of the couple was stressed, and then her partner was asked to talk to her, or not to talk to her, but give a massage. And what happens if you talk to your girlfriend, she's just as stressed as you don't talk to your girlfriend. But if you give a massage to the girlfriend, that works. So guys, shut up and do what you have to do. Another explanation of the placebo effect is conditioning, and is it possible to condition dogs? Of course. You can throw a ball to a dog, and you don't throw the ball, and the dog still runs, because he learned that, and you can do this several times until the dog says, bugger off. And this has been known for ages. This is the Pavlov's dog being conditioned to a bell. That's a placebo. You ring a bell, and the dog salivates. That's a placebo. We can use that in humans. This is a study on children with ADHD. So first they were introduced into an optimal medication dose. This was kept on for 4 weeks. These are 3 groups. Then one of the 2 groups were reduced to half of the medication dose. So 50% was taken off. And as soon as you take off 50% of the dose, symptoms just went up again. But not if you gave placebos. So, for example, a kid got 2 pills before. You reduce it to 1 pill, but you give another sweetie pill containing no medication, and the effects were equivalent to just giving the medication straight on all through. So you can condition the responses to medication by just giving a placebo. So what we see is that we have placebo effects in animals, but maybe they're explained by other factors which are also seen in humans. And maybe that's not even an important question, because we want to know how placebo influences AAT and not how if animals are responding to placebos. One question could be that placebos are driven by deception. Do animals deceive? Are they capable of deceiving? Of course they are. I mean, give me food, I'm starving. You got snakes which look like poisonous snakes, but they're harmless. You got insects looking like owls, just to frighten off. You got this little lizard which tries to be T-Rex, but and you got plants smelling of rotten flesh, just to attract other animals, which they then eat, I guess. There's this ability to deceive. But I don't think that animals give placebos. And talking about placebos, let's have a look on placebos and how they work and how the effects of placebos are. So first thing, you might think that placebos are something that has been invented by medicine, and you might be wrong. It was the Roman Catholic Church who invented the placebo. This is trials, trick trials in the medieval times of people assumingly possessed. They gave them holy water to drink, and they knew that the devil responds to holy water, of course, because he doesn't like it. So they gave them holy water, or they gave them just plain water, and the way this patient, or not patient, but the possessed responded were indicated if he's really possessed or just making up. So in that time, placebo saved many souls because they were not killed by the Roman Catholic Church if they responded in a way they didn't expect them to. The power of the placebo was then discovered incidentally by this guy, Franz Anton Mesmer. You know the word mesmerized? That's Mesmer. He was from the region where I'm from, borders of southern Germany and Switzerland. And he was walking in nature, and he kind of discovered this animal magnetism, what he called it, a power which he can sense, and he could influence how it flows through the body. So he says, if this is blocked, people get ill, and I can unblock it by touching people. He used a wand to kind of touch people with a metal wand and kind of demagnetize them. And this became very popular. He went to France, to Paris, and he got a millionaire there just by treating all the patients in Paris. And then Louis says, this guy, sorry, yeah, you saw Benjamin Franklin, but just briefly. Louis says he was the king then. He was killed by the revolution, which just started afterwards. He said, this should be investigated. And whom did he call for? Ghostbusters, no. Benjamin Franklin. Benjamin Franklin was in Paris at that time, and he was well known in Paris as an intellectual and a nice guy, I guess, a clever guy. And he led a commission to investigate Mesmer's therapy. In the end, one member of the commission was also guillotine. He invented another machine, which killed himself in the end, and the king. But anyways, Benjamin Franklin then did the first placebo-controlled studies. He put patients behind a curtain and the therapist on the other side of the curtain, and he then asked if the patients feel any better. The thing was, patients felt better after animal magnetism, but regardless of if there was a therapist or not, just telling them there is a therapist doing this mesmerizing thing just worked fine. So that was the first placebo-controlled trial, and this is a picture of driving out mesmerism here as a devil up in the sky by the powers of research and placebo. So interestingly enough, if you look at, if you look at the influence of Mesmer, he was influential for psychotherapy. He was maybe the man driving psychotherapy because he discovered the powers of suggestion. And the relationship. And that's a picture from a German textbook on psychotherapy. And what we see here is that we got Sigmund Freud, I guess you're familiar with the name. right here. But if you look further down, that's Franz Mesmer down here. He was the founding father of psychotherapy. We're not too proud of that in psychotherapy. Actually, we kind of neglect that, understandably. But anyways, so talking about placebo effects, how strong are placebo effects? You might think that, okay, there are some placebo effects, they're small and, you know, neglectable. They're not. They're huge. To see if, is that that's the first slide I want to show. This is antidepressants and placebo effect. What we see over years, a stable ratio between placebo and antidepressant effect is like 75% of the effects of antidepressants are caused by placebo. 75%. That's quite substantial. And they are getting stronger. This is starting from 1995 to 2015. So the placebo effect was going up all the time, driving the increased effect of the antidepressant medication. So antidepressive medication didn't get better, but the placebo effect got bigger, and that's why it got more effective. This might be a consequence of very good marketing, and just consider the placebo effect in children. This is a meta-analysis from my own group showing that the placebo effect in children is substantial. Again, 75 to 80% of the medication outcome is caused by placebo. And in depressive disorders, I mean, that's the placebo here, and these are medication. This is like 80 to 85% of the antidepressive effect is caused by placebo. Ooh, that's substantial. We've got an ethical problem here. Shall we give something that's mostly placebo, or shall we give nothing? And that's an ethical problem. Let's look at pain. This is neuropathic pain. Again, the placebo effects are increasing all the time. This is starting from... Oh, this very small print. I can't read. I need to get closer to the microphone. That's better. Yeah. So. 1990s till now, this is the increase of placebo effect. This, going down is better in this sense. The placebo effect got so big that in the end here, you don't find a benefit of active medication in comparison to placebo. So we're running out of effective medication. Of course, the medication is effective, but the placebo is so strong. Are we allowed to give placebos? No, of course we're not. That's deception. Problem. Surgery. Oh, that's surprising, isn't it? Surgery affects like 65% of the overall effect of surgery is caused by placebo. How do you do placebo surgery? There's a study by Mosley in patients 55 to 65 knee problems, very severe knee problems. So what they do, they cut open the knee, put in a little metal thing and do something, take it out, sew it up again. That's the treatment. And the placebo treatment is just opening up the knee and cut it and put it back together. So there was no operation done, just the scar is there. And the effects you can see here. I've got a video on it. Listen carefully.
When I first had that pain, before that, I couldn't do a lot of things I did. Like going fishing or playing basketball or going dancing. And after that, I was able to do that.
He could. Woo. We could go dancing. He took me dancing, and he could dance all night.
Can you describe what the pain was like before the operation?
Terrible, awful. I didn't think that it could be any worse.
It's emotional. Why is it because you were in so much pain before?
Yes.
And what would you say it was that really cured you? Was it Dr. Mosley, or was it you and your mind?
That is kind of an intriguing question, because I got to credit Dr. Mosley for doing what he did. But it was my mind that cured the problem.
Well, he took me dancing, yeah, that's... So let's look at something you might have more experience with, wine. So if you don't know the price of wine, they all taste the same. These are 3 different wines, differences in price. You see the real prices in a sec. If you give them false and real prices, you have differences. So an expensive wine tastes less good if you think it's less expensive. And a cheap wine tastes better if you're told that it's very expensive. So my recommendation is drink beer. Placebo effect in room service. 2 groups of people in doing room services in hotels. One group was told this is room service, and the other group was told this is physical activity. What you're doing is just what the doctor recommends. You're doing physical activity all day. What happens is none of the 2 groups did the same physical activity over the next 4 weeks, but the group being told that this is physical activity were doing much better in terms of body weight, BMI, systolic blood pressure, waist to hip ratio. So they had physical changes just by changing the mindset, not changing the activity. They thought differently about what they do, and that has a great effect. So let's look at the mechanisms of placebo. This is a study given in depressed patients. They were given either antidepressant medication openly, so they were told this is medication, or they were given medication and they were told you might get medication or you might get placebo. And of course, some of them got placebo. What we see is that if you give the medication openly, you have a large effect, the red lines here. If you give the same medication 50-50, I might get it, I might not get it, the effect was equivalent to that seen in the placebo. So knowing you get medication has a profound effect on the effects of the medication. And not being sure leads to the same effects as you get placebo. So expectation, I get something, is a driving force behind the placebo, behind changes. Another aspect which is really, really important is the relationship between the one providing the treatment and the one getting the treatment. This is a study on placebo acupuncture. Acupuncture punctures the skin, and that's acupuncture. Placebo acupuncture doesn't puncture the skin, but the needle goes into the shaft of that little thing here. So you can't really tell that you get placebo acupuncture or not. And what the group of Kapchuk then found is that if you give acupuncture in a very limited way, meaning you don't speak to the patient, you just needle. In comparison to augmented, which means how are you doing, just normal conversation actually, you have double effect if you talk to your patient. So talk to your patient. And you might needle them if you want to. So the relationship is really important to have placebo effects. But then again, I mean, overall, we have to be aware that placebos cannot have any effects. There's nothing in there that has effect. It's inert, it's empty, there's nothing in there. And Dan Merman, this is the guy, he wrote this article in 2002 saying, forget about the placebo effect. Placebos have a meaning, and the meaning has an effect. So he says, this is a meaning response, not a placebo effect. We respond to meaning, and that makes it, I guess, meaningful for us, and to consider placebo effects. But then again, we got another intervention, which is also driven by the meaning response. That's for you, Richard. We were talking about this yesterday. That's Jerome Frank, psychiatrist from Johns Hopkins, and he in the 60s came up with this contextual understanding of psychotherapy. He says patients come into therapy, they are demoralized because they don't understand the symptoms. And what we do, we change this meaning of the symptoms to something that's moralizing, helpful, and then patients get better because they have a different perspective, a different mindset on their symptoms and what's happening in their life. And the conditions that are needed to have this change and the transformation of meaning is we have a professional, trustful, empathetic relationship, and we have something that is plausible for us. We need to have like a myth and a ritual. and these are the basic ingredients of psychotherapy. He said this in 1960. There was a huge research program by Bruce Wempold, and if you ever need to read a book, this is it, The Great Psychotherapy Debate by Bruce Wempold. You have to read that. This is like 20 years of psychotherapy research in one graph. And he, in the end, said, what is really important in psychotherapy? What's driving psychotherapy? You cannot read this, so I just flipped it over to be able to read it. What is it? It's shared goals, empathy, relationship, regard to the patient, the therapist as a person. It's the congruence, it's the adaptation to the patient, and maybe it's a little bit of expectations. These are the factors that are driving behavioral and personality change in psychotherapy. These are the same factors we see in placebo. So we have a little problem here. Psychotherapy and placebo are driven by the same factors. You cannot differentiate theoretically or empirically between psychotherapy and placebo. The only difference between psychotherapy and placebo is here given by Irving Kirsch. A placebo is something that is sham, fake, false, inert, and empty. Psychotherapy is none of that. So that's an ethical definition of what should be psychotherapy. Question is it possible to have a placebo psychotherapy? We tried hard and we succeeded. This was our placebo. We gave that to young students and said, this is green, as you can see, it's moving, and that's very good. It affects emotional schematas in you. We came up with this funny explanation, all fake and all false, all wrong, and we gave this to the students twice for 7 minutes, watching that, saying, really dig into that green, and get it, get in there. And what happened is, it's quite effective. It's equally effective as giving 2 days of group psychotherapy to patients, because I've done these studies, and we see these, they are lasting. 1 week after we gave these twice 7 minutes, we still had large effects in healthy students. Actually, some of the students got it on their smartphone as a screensaver. I can get rich of that, but then Benjamin Franklin comes and anyway. So one question is, why do we respond to placebos? Why? You might think I'm not responding to placebos, but well, you are. We have this built-in need to respond to placebo. We got symptoms. That's a symptom here. And of course, symptoms have a function. They have function like modulation of physiological responses. So if you get sick, you have immune responses which are helpful to kind of fight the bacterial or the infect. You have reduced energy expenditure through rest, so you lie on the couch and you rest, and that's good, helpful. But also, we have a signal to the social environment. I'm sick, help me. And we are social animals. Not all animals show these signals, because if you show this in some animals, you might get eaten. But we do show these symptoms, and we receive treatment, and we respond to the treatment. And as soon as we receive treatment and social support, the symptoms are not more anymore needed. So you don't have the symptoms anymore; they go away. Animals do it. Even elephants do it. Ants. If an ant is sick, the social network responds to that and isolates it. If an elephant has distress, another elephant comes up and puts his, how do you call this thing? Trump, yeah. Trump? No. Trump. Yeah, I'm Switzerland, sorry. Yeah. So animals do that. Animals respond to symptoms of others. And then the symptom goes away, because you're not, signal received and therapy received. Interestingly, you see that also in pain tolerance. So the larger your social network is, the higher your pain tolerance. You don't need to show pain if you got friends. If you don't have friends, you need to shout. And this just shows here. So all in all, we got meaning responses. We respond to meaning. narratives are formed within relationships and they change. I will give an insight into myself. This is my hip in 2009, I think. I had hip problems. I went to the doctor and he said, how old are you? I said, 38. And I said, oh God, you're 38. You're going to have hip replacement at your age. That's bad. I walked out. I could hardly walk after that. It really hurt. I had problems walking out of the door. I had three little children. I thought, God, this is the end. I'm a young dad and I can't walk and stuff. I went to another doctor, second opinion. He said, where do you have pain? I said, left. He said, you should have it on the right side. I walked out for 2 weeks. I was doing totally fine. This doctor was wrong because it was on the left side. I had an operation in the end. But anyways, I thought, I'm immune against placebo response. I'm not. I respond to that. This is my spine. You get very deep insights into me nowadays, tell you. I'm not showing that in public. I mean, just amongst us. This was like 3 months ago. I had a disc prolapse. I went to the doctor. And of course I got medication, which helped a lot. I liked it. I was in severe pain. But the doctors and the physiotherapists, they responded to me. They gave a meaning to it. They were giving their own person into therapy, and that's what that helped me, I must admit. So, I mean, just as an example of how strong the meaning is of that. I remember one day when I came into the physiotherapist, said, I don't know if I could lift something, and he took me and bended my back, my marrow, my backbone, and it cracked. And he said, that's what you can do. And after that, I started going shopping again, which was helpful. So, placebo, nothing works better. That's our slogan. How can we use it? That's operculp. It takes some time. If you spell it backwards. Here we go. Invented by a mother, she got sick. She wanted to treat her kids, so she discovered operculp. She just gave these tablets to the kids, and she's selling it online, I think. Of course, we cannot give placebos. We are not allowed to deceive patients and kids, although it's tempting. So what we do is we give placebos openly. You give a placebo, that's a placebo. That's a placebo. It works. It works through expectation and conditioning. You don't have to believe in it, but you have to take it regularly. That's the 4 things we say in open label trials. This is on IBS, irritable bowel syndrome. Quite hard to treat, actually, but open label placebo, they work fine. Significant clinical meaningful effects by giving open label placebo. Back pain, chronic low back pain. These were patients from Portugal. They were all treated. They didn't benefit from any treatment before, so they got open label placebo. And the effects are astounding. There's a video out there showing female patients then meeting and laughing about it, how they were suffering before, and having a good time by taking open label placebo. We investigated if open label placebo, it's not placebo, if open label placebo or deceptive placebos have different effects. They don't. That's the open label and that's the deceptive label. So it doesn't matter if you deceive someone, just give a placebo, and if you provide a narrative to explain it, that's it. And it works. And it works big time. So a placebo is not just a nuisance in clinical trial. It's not only used to sort the chaff from the what? What is it? From the wheat? Yeah, wheat. It informs us how interventions basically work. What are the bare bones of interventions? It's expectancy, it's a relation, and within this, a narrative is formed which helps to transform a meaning. So, open up this contextual perspective. We have the built-in need and ability to respond to treatment. And we have the ability and motivation to provide a treatment. In the end, we establish a personal relevant narrative within a trustful an empathetic relationship. And so far I've been talking about humans, and basically most of the stuff I was showing was based on human on interaction between humans. But let's consider that. I mean, this can be done here also. This is happening here. What we have here is a trustful relationship. It's a model for learning how. I mean, you see I was informed about this. I'm not an expert in ponies. The ears go back, so the pony is not totally relaxed, I think. This might be a model for this little child to kind of see, oh, how important are emotions. This pony is totally congruent. It's him or herself, I don't know. And I think that's a perfect illustration of the basic mechanisms that are needed to achieve change. It's an enrichment of the context which helps to establish a good relationship between the between the therapist and the patient, and that living being that kind of helps this young person. Of course, this enrichment of the context has an effect. This is a study that came out last week, by Karin Hediger, showing in patients with acquired brain injury that animal-assisted therapy does help. You see here the effects on social behavior in these patients, which were achieved by adding this animal to the therapeutic context to help these patients to achieve a clinical, meaningful outcome. So let me sum up. I mean, I'm not an AAT guy, as you might know now. And I'm a bit humbled to talk about implications for your field, for my field, because I'm not expert in your field. But being here at the conference, I listened carefully to what you said and what I heard. So let me phrase it that way. I think what would be very good from my perspective is to define and empirically test what happens if you, sorry for the expression, throw in an animal into the intervention. What happens to the intervention if an animal is present? I didn't get this answer to that question so far, but you need to test this and to show that this is really something that changes the intervention, that adds to the intervention. And you would then also find out where are the limits of using animals in interventions. Also, do more research. I just PubMed, is that a word? Googled the number of publications from the AAT area and compared this to psychotherapy. You started in 1999, it was 24 papers out there on PubMed. Now it's up to 180, which is good, a large increase, but you need more. You need more very, very good papers to kind of get cited. I think you need to have the basic papers which are cited all the time. That would really help. I'm coming from psychotherapy and placebo. I never heard of animal-assisted therapy until I came across in my own division. And that's a pity, because we would learn so much from animal-assisted therapy. You talked about animal welfare. I never heard to talk about welfare so much in my psychotherapy congress meetings. We should talk about therapist welfare where we don't, and patients' welfare maybe. So I learned a lot about that from your side, and I think don't underestimate your knowledge and expertise in that area. Also, be humble. Acknowledge the powers of placebo and the context of treatment. You are, even though you are using an animal within this treatment, you are still within a treatment. And I bet my very good right hip that you're not outside this world of interventions. Maybe also do not speak only in your own language. I was sometimes puzzled by the language you use. Use a common language in terms of, like psychotherapists or people in the mental health area. And please stay enthusiastic and caring as you are. Thank you very much.
Thank you very much, Jens. We have time for maybe 2 questions. Any questions in the room? Yes.
Forgive the very basic nature of this question, but what is in your placebos that you use in your trials?
What is in the placebo? Oh, we use different placebos, sometimes creams, sometimes... Is that the answer to your question?
What does it consist of? How do you find...
Oh, anything
define?
is a placebo, anything. We just call it effective, and it's not.
I see someone in the back. Hang on a second. I will be right there.
Your green screen, any talk about mindfulness there, that 5 minutes of mindfulness a day is effective, and your green screen was 7 minutes?
Yeah.
Maybe not
Well,
completely a placebo?
I guess you consider mindfulness as being not a placebo.
Okay, we are breaking my rule of 2 questions because Phil Tedeschi has a 3rd question.
I was wondering if you could tell us if you've had any experience of, let's say, the placebo effect in situations where somebody is perceiving, let's say, discrimination or threat or fear in circumstances like that.
There are studies showing in people being discriminated because of the color of their skin, if they are told that this is not because of the color of their skin, but because they are first-year students, their academic performance is totally different. These are studies done in Stanford, and I was intrigued by that, just giving a different mindset to someone feeling discriminated against just changes substantially something very important like academic behavior. I still think there are political actions needed to kind of level out discrimination, of course, but that might be an example. Walsh is the principal investigator on that.
Thank you again. You will be with us for the next few hours, so bring your questions.